I'm Dawn. I'm an avid horsewoman and I've been riding my whole life. I'm here to introduce True Partnership, the McChesney method with Erin McChesney. Horses are fascinating and complex animals. So whether at home or away with your horses, it's important to know certain procedures for their care and the correct way in dealing with them. That's where Erin comes in. She's been training horses for over 40 years and has her own clinics and training programs. She discusses topics that all equestrians can benefit from. I'm Dawn Kerr, and I hope you enjoy True Partnership, the McChesney method with Erin McChesney.
Today we're going to learn about our home health check. It's important that we understand what each of our horses in the barn is like when they're normal and healthy. So we have to pick a time of day to begin this check. I recommend in the morning before you feed to do a whole bunch of checks on this horse to see how they're doing. What's their heart rate, their respiration, their gut sounds. Also, I want to know about their capillary refill, their mucous membrane, the skin tint, and their jugular refill, and their anal tone. Sounds like a lot. But if I know where this horse is normally in the morning when he starts out, if something doesn't seem quite right about him, I have a lot of ways to check to see if this is something that I can handle on my own, or if I need to call my vet to have them come out, or if I need to, thanks for trying to bite me, buddy, or if I need to take my horse into the vet. So let's start with some simple things that we can look at. I want to know if my horse is well hydrated. Now in our barn, all of our horses drink out of muck buckets. They're half bushel barrels that hold about 25 gallons of water. And I know how high they were the night before, and I can tell by looking at the water level how much they've drank during the night. But if I were in a position where the horse had been out in the pasture, drinking from a common water trough, or on an automatic waterer, I may not know how hydrated he is. So one of the ways I can start to check his hydration is to do what's called skin tenting. Skin tenting, like a tent you would live in if you went out in the woods, T-E-N-T. So I'm going to pinch the skin and pull it up a little bit. And I'm going to pick 3 or 4 places. Now this horse is 19 years old, so he does not have the elasticity in his skin that a younger horse would have. So he might, especially over here, going over this region of his shoulder, have a little holding of that tenting, or a little slower going back. If you notice that it doesn't go back right away, there's still a little bit of a bump. But when I'm here over the round part of his shoulder and up on his neck a little bit further, that the skin tenting, it snaps back pretty fast. That's a way to know how dehydrated your horse is. If this skin tenting stays stuck in the up position and doesn't go down unless you push it down, your horse is very dehydrated, and you probably should just stop there and call your veterinarian. The next way to check their hydration, I'm going to move him just a little. Scoot over, buddy. So his neck is a little more in the sun. So I'm going to find this groove in his neck. This is where his jugular vein is. And I'm going to push my thumb in there. It's hard to see because it's winter time. But you'll notice right in here that it'll raise up. Let's see if I can turn him just a little more. Come on, bud. There we go. And I'll try to stay out of the shot. So I'm going to push my thumb into that groove, and you see how that fills up with blood? So you're going to watch right in here. It's going to go from this dimple, this little ridge in there, and it'll fill up and flatten out. Helps if their head isn't too high. See how that bulges right there? So do it again. Watch right here. See how that changes? And then it goes down, and then it comes back up. So if that goes up and down pretty easily, and you've done your skin tinting, you can say, well, this horse is well hydrated. I think I'm okay. The other thing we can check with horses is called their capillary refill. That's in their mouth. Tahoe does not like this procedure very much. He usually gives me a little bit of grief over it, but I meet him where he is and I do my best to get it done. When we do endurance rides with him, I have the veterinarians check this on him last because then he's less annoyed by the vet check. Okay, so we're going to talk about capillary refill. Capillary refill means that we're going to look in the horse's mouth and we can see how pink they are. And we're going to push with our thumb right above the tooth, hold 1, 2, let go, and see how fast that pink color comes back. Because once we press on those gums, we actually stop the blood flow for a moment. And we're looking to see how healthy this horse's circulation is and how hydrated he is. That kind of tells us if he's well hydrated too. So if we look inside his mouth, we see the color of pink that he has. So we want to press against his gums right above his tooth, and we're going to hold 1, 2. That's going to make those gums turn white or whitish, and then we're going to release and count backwards, or 2, 1, or however you want to do it, and check to see if the color comes back in the same amount of time it took for us to push against the gums. So I'm just going to go ahead and take a peek here. I'm going to put my thumb right above his tooth and hold. Oh, come on, buddy. 1, 2, let go, and we see the color came right back. So let's see if he'll do that again. Horses have to be taught to tolerate this. It's not something that they just usually go along with. It's all right, bud. Because sometimes they think we're getting ready to stick a plunger of worming medicine in there. 1, 2, and we see the color comes right back. The capillary refill, what we're checking for is to see how well the body is moving blood through the whole system. And when we check those gums and we push 1, 2, let go, 1, 2, and see that it comes back at the same rate, we can be pretty confident that the horse is moving blood evenly through his whole body. Are you exhausted from all of that? It's really tough to be you sometimes, Tahoe. So the next thing we're going to check is his mucous membrane. The mucous membrane we're going to check around the eye, and that is another indication of how well the horse is doing. When we look at the mucous membrane, we're just going to pull his eyelid back just a little bit and observe the color underneath of his eye in this area. Oh my gosh, I should have got a different horse out of the barn. You are so silly. And we're going to look and see what color it is. It should be a little more pink than in his mouth, if you see there, but it shouldn't be red. If it's red, then we need to wonder if he's got some kind of irritation to the eye going on, or maybe if he's in some state of distress. You having a hard time? He's exhausted. Okay, so now I've determined that my horse is well hydrated, he has good capillary refill, and he's got good color in his mucous membranes. So now I need to know what his pulse is. I have 2 types of stethoscopes here. So we'll start with this green one. So this green stethoscope has ridges on the edge, which means when I hold this, I need to hold the edges of the stethoscope with my fingers. I don't want to leave my thumbs or my fingers on it like this, because what will happen is, even if you're young, when you have your fingers on the stethoscope here, we can't help but move a little bit, and you will hear the creakiness of your joints. And sometimes if you have like your thumb against the outside of it here, you'll hear your own pulse. So it's hard to count your horse's pulse when you're hearing your own. So this particular stethoscope we have to hold by the edges in order to get a clear sound. This one, and move over here, also has the ridges that you can hold on the outside, but this particular style has this little hole in the top. See, there's a little hole right there. So I actually have to cover that hole with a finger, a digit of some kind, and then hold the edges in order to use this one. Some people feel like they get a better sound from this type of stethoscope, but with all stethoscopes, it takes practice. It's not something that's very immediate that I can just put them in my ears and go to my horse and I can hear everything. So we're going to start with finding his pulse. And when we measure his pulse, we count the beats for 15 seconds and then do the math, multiply times 4. When a horse's heart beats, a very large organ, it goes lub-dub, lub-dub, lub-dub. That's lub-dub is 1 beat, not 2. So that's important to remember too, that when you hear that lub-dub, you're hearing the 2 big chambers of the heart beating, and that counts as 1 beat. You won't just hear bump, 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 bump type of thing with a small, like you would with a smaller animal. Okay, kiddo, let's see if we can come around this way where everybody can see you. Scoot, scoot. There you go. A little more, a little more. Whoa. Okay, so we're going to listen for his heart behind his left elbow. And if I get up here, I'm not going to hear it. I'm going to hear his lungs, though. If I get too far down here, I'm not going to hear it because the sternum of the horse is very thick and it's going to get in the way. I need to find this kind of pocket right here where the girth goes. I know, I see you. And that's where I'm going to listen for his heartbeat. Oh, bud. And I always slide this down first before I place it, just so the horse knows that I'm going to come in and be listening to their heart. Okay, so we got 10 beats in 15 seconds. Times 4 means his heart rate is 40. So that's a good resting heart rate for a horse to have. In the morning, though, with this horse, his heart rate is a little bit lower, actually, than he is right now because he's been very relaxed in his stall and he's really nice and quiet. Another place I can check for the pulse is under the jaw. If I feel under the jaw and the back side of this bone here, the jawbone, there is a big vein. And I'm going to put that vein between my fingers. Let me set these aside so they don't hit my mic. So I'm going to feel for that big vein, and then I'm going to lightly press my fingers on either side until I begin to detect the pulse. So now I found his pulse. And actually his pulse has dropped now. Now I got 8 beats in 15 seconds. So that's 32, which is more along the lines of his normal resting heart rate. He's a very athletic horse, and more athletic horses and the more fit they are, the lower their resting heart rate will be. So this works really well on some horses, is very hard to find on others, and if they move their heads at all, you're going to lose the feel of the pulse under your fingers. So when you use this particular location, you're going to actually feel the pulse streaming past your fingers. Sometimes if we push too hard, we actually stop the pulse moving there, so we have to back off until we notice it. The next place I can check for his pulse is behind his knee, so it's right in here. And so I'm going to feel for the vein that's running down behind the knee, and I'm going to, same thing, use my fingers, and I'm going to press my fingers against the vein and the artery and feel under the vein for the artery until I detect the pulse under my fingers. And now I've got his pulse. And so now I got 9 beats in 15 seconds. So now his pulse is back up to 36. And that's okay, because like us, every time we move and do anything, the pulse rate is going to change a little bit. When I feel the pulse here, or when I feel the pulse under here, it's going to be just a simple beat. You're going to feel a simple stroke of the blood going through the artery. You're not going to feel a lub-dub like you would do when you're listening to the heart. So in the morning, I find out what his resting pulse rate is. I notice how he is on his skin tent. In endurance rides, NATRC rides, and eventing, they use A, B, C, and D. And so if he's got good skin tent, that would be an A. So I would make a note that that's an A, that his jugular refill was an A because it was really quick to fill up, that his capillary refill and mucous membranes are A's right now, and his pulse, if I average everything out, I'll just say it was 36. And so then I'd say that's where he is when he's resting. So far, I've got a pretty healthy horse. I don't need to worry too much. And I can proceed now to check other parameters about him that I need to know early in the morning. And I say early in the morning and do it at the same time because we want to be able to compare that if the horse isn't acting right or just doesn't seem right. You have some way to say, hey, I know that this is what is normal for my horse because I checked all of these things on my horse every morning for about 2 weeks straight. I have a little bit of data that I've recorded somewhere in a notebook or put it in my phone, and I can compare that and say, wow, his pulse right now is 44 and his skin tent's kind of a B. Maybe something isn't quite right. So before we listen to gut sounds, which we're going to get to here shortly, there's a couple other things that we would do. We can check their temperature. So you can use a digital thermometer if you like, or the old glass type thermometer. This one has a piece of yarn on it for a reason. The reason for that piece of yarn is so that when I would insert this thermometer into his rectum, then I could take this string and sort of loop it over his tail so I don't lose it. But the important thing to remember is that this thermometer is reacting to outside air temperature. It currently reads 104.4. If I don't shake it down below normal for this horse, I'm going to take it out and think, holy moly, my horse has got a temperature, because it's going to have to graduate down its temperature in the time that it's inside of the horse, and it might not move enough in the time for me to take it out. So I have to make sure that it is below. So now I've got it down to about 98, 99, that it is where I need it to be. But I'll show you why I need that string. And with the glass thermometer, you've got to go almost all the way to the end. And take this string like this and just kind of wrap it a little bit around. That way, it's hopefully going to stay there. So you have to be careful with this type of thermometer that you don't walk away and go get a cup of coffee and talk to your neighbor, because if he poops or manages to expel it and it breaks, then you've got a hazard there, because it does have chemicals in there that check that move the temperature up. So then once I'm done taking his temperature, I would remove this, and you won't change the temperature by wiping it off on his tail. And then I would look to see what the temperature is. And I didn't leave it in there long enough for it to really change, but that's how I would use a glass thermometer. But that string's really important, because sometimes a horse will do something really odd and actually pull that glass thermometer into the rectum more, and you want to be able to find it. So that string also helps you with that. With a glass thermometer, it's going to react slower than a digital thermometer does. So my suggestion is to leave it in for 2 minutes. So stay attentive to your horse for a couple of minutes, and then you can check to see what the temperature is once it comes out. The nice part about the glass thermometers is if you set it down and you actually ended up having the veterinarian come out, as long as you don't shake it or leave it in the sun, you'd be able to show them what the temperature is if you forget. So then a digital thermometer is going to react faster. And a digital thermometer, though, you have to stay here. You can't walk away, because it's going to fall out on its own. The glass thermometer is further up inside the horse's body. If you walk up to the front to feed him cookies to say, I'm really sorry that I violated you, then you could walk away. But this one, you have to actually stay here. And you see this one's very fast in determining the horse's temperature. Okay, Then as long as we're back here, and we've already got our hands dirty, we're going to check this horse's anal tone. So anal tone means that I'm going to check and see how much he springs back against my fingers. So if I put some pressure here along the top of the anus, he's going to push back with that. And a horse that's healthy and in good shape is going to have a good reaction. If the horse is not feeling well for some reason, they have a temperature, they're colicking, or some other ailment that's bothering them, this will be a little more slack and it won't have that good response. And that's another way of saying, wow, you know, my horse may not be feeling so spiffy because their anal tone is not very good. So now we want to listen to gut sounds. Gut sounds for horses kind of are everything. That's where the buck stops, okay, at gut sounds. If a horse, if they're colicking, if they're running a fever, if they've traveled too long, they've been in the trailer for too many hours and it's been too hot or too cold, or they've had a radical change in the feed that they've been given, or some other kind of stressor that has set them off, your gut sounds in your horses are going to go sideways. And that's a problem because that's kind of their weakest link, if you will, their Achilles heel. We don't want to miss how this horse is doing on the inside and get them in trouble. And colic, from my own personal experience with over 40 years of horses, colic is very, very subtle. It's not something that you're just going to go out there and the horse will have your traditional symptoms. I'm laying down, I'm pawing, they're biting at their sides, I'm kicking at my sides, I'm looking really distressed, I'm stretching out, you know, camping out like a picnic table. All of those things are not necessarily going to manifest in the beginning of a colic. Most colic episodes can be picked up simply by noticing some subtle things, like in our case with us, we had a horse who got a little bit of touch of colic recently, and our first thing that we noticed is she'd been in the barn all day and didn't drink any water. And when I checked her pulse was 40 and her normal resting pulse is 36. So immediately I was like, okay, something's not right. So we started listening and discovered that she was very gassy in this upper quadrant here that's called the cecum, which we're going to talk about more in a minute. And I had to treat her with some Banamine, and after a couple of hours she was fine. But that was a very mild colic episode that could have turned into a very large and critical thing where we'd be making a very difficult decision about whether or not to do surgery had we not noticed and just fed her and moved on, because she was not pawing or kicking or laying down or rolling or thrashing, which by the time the horse reaches that point, they're in a time for you to just call the vet. At that point, you can do your own evaluation just so you know more when your vet gets there, but if your horse is at that stage, you need to call the vet. So just to clarify, when we took Tahoe's pulse, we got a pulse rate of 40, then 32, and then 36, and we said, well, we'll just call his normal resting heart rate 36. When I was mentioning our other horse who had this mild colic episode recently, and when I took her pulse was 40, that was elevated for that other horse. Her normal resting heart rate is around 32 to 36. So for it to be slightly elevated was enough for me to say, well, I need to look a little further. So when I went to look further on this other horse, and what I do with him as well to show you, is I'm going to be listening to the quadrants of his intestines and his whole digestive system. So the first thing that happens is the horse eats and chews. He begins to get some saliva in here. He'll swallow what are called boluses of feed. Sometimes you'll see these lumps going down their neck. And that goes down into his stomach. Once it's been in the stomach and it's been agitated almost like a washing machine and mixed up with stomach acid, then it's going to move into this lower region here into small intestine. And once it's spent time in the small intestine, it's going to move up into here into more small intestine. And then it loops downhill and ends up on the lower part of his right side. Scoot over, bud. So once it leaves the top of his left side, it comes down to the lower of his right side, hits the large intestine, then moves up into what's called the cecum. And then the colon is back in here, and this is where the horse starts to put things together and extract water from their feed and to create fecal balls. A lot of horses have colics that are associated with the cecum getting really gassy and distended. And just like people, when we have some kind of digestive upset and have a lot of gas and things, it's very painful. And horses don't know how to tell you that they need something for that other than the pawing and the rolling and so forth. So when I first start to listen to his gut sounds, I always start on the left side. Tahoe probably thinks I've lost my mind right now because I keep asking him to stand this way and then that way. Come here, buddy boy. You're doing great. Scoot around. Scoot around. Oh, right there. That'll work. Okay. So I'm going to listen to his guts lower left and then upper left. And they should sound like a lot of gurgling and a lot of gurgle glub. And sometimes it'll sound like some far away rumbling. You'll hear this weird kind of almost sounds like something straining or being squeezed through small spaces, and that's totally normal. And then I listen up here. And I'm going to hear similar, really wet, gooey, gloppy, bubbling sounds going on in here. And that's normal. And it'll change depending on how long the horse has been from his last meal. Because this is the first system that he's going to take his food into after the stomach. If he hasn't eaten in 10 or 12 hours, then this side's going to be a little bit quieter because there's not as much feed in this area. If he ate an hour ago or 2 hours ago, this side's going to be really active and really, really, really noisy. And I want to know the difference between that with him, so when I listen to him, I can very quickly decide, is that normal or not? Perfect timing, bud. Oh, so now we know that things sound pretty good over there in the first quadrant and the second quadrant. First quadrant is low left, second quadrant is upper left, now third quadrant is lower right. This area should sound like the other side. So when I listen, it should still have that gurgling and glub glub sound. Sounds pretty good in there. So now we know that, okay, 3/4 of his system is operating really, really well. He's in good shape. Sounds nice and wet in there, which is always important. We know he's well hydrated because we already checked. Okay, so now we're on to the fourth quadrant. Fourth quadrant is called the cecum. And then it leads to the rectum. That's where the poop balls are put together, the fecal balls are made. But the cecum is really, really critical. A lot of feed goes into there. It all of a sudden gets to be a larger space. And this is where horses usually get in trouble. They'll develop gas in there and it blows up like a balloon and it's very painful. So when we listen to the cecum, it should kind of sound like faraway thunder. It's not going to be the same kind of wet, oh, okay, hold on a second. He's very nerdy. It's not going to be that wet, juicy kind of washing machine sounds that we've heard everywhere else. This is going to sound different. It's going to sound like faraway thunder or sound like somebody that burped with their mouth closed, that sort of low rumble. So we're going to listen for that. And the other thing with the cecum is it's a quieter quadrant. You may have to wait longer to hear something. The other ones, especially on the left side, are going to be really active and you're going to hear things right away. This side, it might be, I'm waiting and waiting and I'm not hearing anything. Sometimes you move around just a little bit. Usually if you move down towards the flank, you're going to get a better sound. But you can tell that the texture of what's happening in there is different and the sound is very different. So he sounds really good in there, kind of far away thunder and sort of some like wet food being moved along, but much slower and less actively. When this is in trouble, it'll echo like a cave, like you're in a cave, and it'll sound like somebody's way far away dropping pennies in water. You'll hear this plink, plink, plink sound followed by a loud echo, and then just nothing but silence in between. If that's the case, I would call the vet. I wouldn't even hesitate, just call the vet. That means that that chamber, that quadrant is filled with gas, and we don't know what the cause of that could be. We don't know how bad it could be. And it's something that we need to take very, very seriously because it's really painful. And if a horse starts rolling and thrashing, they can injure their intestines and their system and get a twist or something going on in there, and that could be really, really bad. So if it sounds like an echo chamber, and if you hear echo chamber and you hear this like plink, plink, and then this echo that follows, that's a sign to say, I'm going to go call the vet. And as long as your horse is quiet at that point, if they're not actively pawing or rolling and they're just sort of hanging out like he is, they might have that condition going on and be pretty quiet. That's okay. You don't need to do anything extra at that point. Just hold until your vet arrives. But if we have taken the time to know exactly what is normal for this horse and what his guts sound like on the inside, if I have any questions about whether or not he's doing okay, then I have something to compare it to. I've listened to him enough to be able to very quickly assess whether or not he's within his normal boundary. And different horses are different sounding by the way that they are. Maybe it's because of the size of them or their age. Horses that are getting older are going to sound a little bit different than they did when they were younger. So it's important to keep up with how they sound as they age so that we don't misdiagnose them, or worse yet, miss that they're actually in trouble. So that's your home health check. Sorry that Tahoe didn't help us too much with the capillary refill. We'll try to see if we can work on that, huh? He has never liked to have things in his mouth. I mean, he's fine to be bridled, but he sure doesn't like you sticking your finger in there. But anyway, this is a good way to get a good snapshot of my horse's health and to see where he's at and to see, is he doing okay, is he not doing okay. And if anything seems odd, he didn't drink enough water, he seems like he's not super interested in his food, he's standing in a corner looking different than he normally does. I mean, that sometimes is an indication that a horse is in trouble. They're just standing in a spot they don't normally stand in. And you're like, wow, why would they be standing over there? And that could be an indication that the horse isn't doing well and we need to check and see what's happening. I would encourage you, though, when you're checking all these parameters, to don't forget to take their temperature, because a lot of times a horse will colic because of a temperature or a fever that they're having. And if we know that their temperature is elevated, then that's really good information to give to your vet. And if they do have an elevated temperature, it's time to call your vet and ask them to come and check the horse out and make sure they're okay. So that's your home health check in a nutshell. And Tahoe, you did pretty good, bud, considering. And I encourage you to practice these things with all your horses and to create some notes on every horse you have in your barn so you know what is normal for everybody, that you can catch them before anything gets too serious. And encourage you to, learn as much as you can. Ask a lot of questions of your veterinarians and your friends who know a lot about horse health. The more that you know, the better you'll be able to advocate for them and to keep them happy and healthy. So we want to talk about kind of a basic first aid kit. Now, some of the items that are in this selection that I have set out here for you are prescription, and you would need to get from your veterinarian. But we'll go over that as we get started. So it's always good to have some sterile gloves, or even if they're non-sterile gloves, that you can have around in case you've got to clean a wound or apply something that's really sticky and gooey. You should have some kind of gloves to use, or maybe you're working close around the horse's eye and you don't want to, in an attempt to clean out the eye or to administer to them, you don't want to introduce other contaminants in there. So gloves are always really important to have. All kinds of wound care, whatever it happens to be. This one is a zinc-based wound care for basic scrapes. This is a salve called a gall salve, one of my favorites. Works really good. According to a dear friend of mine, told me about 30 years ago that it'll grow hair on a bowling ball. I can attest to that. It's really great stuff. This is actually a prescription salve that I got from the veterinarian. Very expensive, but used for specific purposes, and when you have it left over, you watch it like gold. We talked a little bit earlier in the episode about different types of thermometers. You can have your digital thermometer, you can have a glass thermometer, whichever one that you would like to use. Remember, with the glass thermometer that you want to tie some kind of a string in the end. It has a little loop there for you to do that, and to be very careful with this item so that it doesn't get broken, and then remember to shake it down to get the temperature down before you use it. So some way to measure the horse's temperature. Stethoscopes are kind of an interesting item and a very necessary item in the barn. Every barn should have a stethoscope and a hoof pick. Between those two things you can solve a lot of problems. So stethoscopes are one that you will have to experiment a little bit to see which one you like, which one you can hear better with. Sometimes the ends of the stethoscope have a little bit more bend to them than these do, and you want to play with it when you put them in your ear, and you can listen to your own guts. See if I have any gut sounds. Yeah, I'm alive. So sometimes you can't hear very well, then turn them around, because if they're the type that have an angle at the end, they might fit better and tighter in your ear one way than the other. Sometimes too, people need to open their mouth and breathe quietly through their mouth when they have the stethoscope in, so that it changes how your jaw sits, and it kind of opens it up, makes the stethoscope sit in there better. And also, stethoscopes are going to pick up external noise. So if the dog is barking, you're going to hear that. If something's rustling nearby, you're going to hear that. If you hear people are talking, you're going to hear that. Get used to being able to listen for what you're listening for, whether it's the heartbeat or the gut sound, even though you're going to get that extra noise. And remember to hold the stethoscope properly around the edges so that you don't contaminate the noise. And the best way to learn where to hold it is to put your fingers in the wrong place so that then you can see what I'm talking about. And then if it's the type that has the hole in the end, remember you've got to put your finger in there and hold the edges to make that one work. So a stethoscope is really important to have as well. Wound care, besides the different salves and things, sometimes we have to clean them out with hydrogen peroxide. If it's something that you think is kind of a dirty, raggedy looking wound, you can use some peroxide to hopefully kind of boil out some of the contaminants that are in there. Alcohol, I would not put alcohol on a wound on a horse. It stings really badly. It's definitely going to light them up. But if you are trying to ice a wound down that, or if maybe a horse has a swelling in their leg and you want to put ice water on it to try to quickly reduce the swelling, if you add a little bit of alcohol to a bucket of ice water, it makes it colder. And so it can be more effective if you're trying to get really cold. But also it's good to have this around because you might need to clean and sterilize some of your equipment, whether it's the thermometer or maybe a syringe that you're using. If you're dosing syringe, you want to sterilize it. You'll have some alcohol available. So this is a dosing syringe. When we give the horses something like bute, this is bute in a powder form. Bute also comes in a tablet form. It will dissolve easily in water either way. I've found that the best way to give my horses bute, if I'm going to use a syringe, is applesauce. So to mix a little bit of applesauce, I'd put about this much applesauce in there. This is a 60 cc syringe, so I'd put about 25 cc's of applesauce and about 15 cc's of water that has the bute dissolved in it, and then stir that together, and then go ahead and stick that in their mouth and then plunge that at the end. And if your horse is really uncomfortable with that and doesn't like it, then add a little bit more applesauce until you fill it up. It doesn't matter if you have to fill this up 2 or 3 times to give them the amount of bute your vet has recommended. The more applesauce, the more appealing it is, and the less the horse will complain about it. Sometimes these syringes get really hard to push, and so I'll use a little bit of cooking oil and just put a little cooking oil around the outside right there on that rubber cap, and then do this with it a few times to kind of coat the inside of the tube, and then it's easier to plunge. Q-tips. You never know when you're going to need a Q-tip to clean out a wound, especially if horses, sometimes in the summertime with the dust, their eyes will get really gloppy and big gooey stuff in there. And if you're very careful with a Q-tip, you can get right on the corner and kind of help to remove things. That's really handy to have. Some type of cotton or gauze swabs. These are the small ones. So sometimes we need to clean a wound, so these little cotton rounds like this are really handy. You can get them wet and then use them to clean the horse's wounds. And an iodine solution, this is actually an iodine soap, is really helpful for cleaning out and having an antiseptic cleaning of the wound if the horse needs that. And so this works really good as an alternative to cotton, but you can use cotton also. And when you're using this cotton roll to clean wounds, you're going to go into here, roll this paper back a little bit, if I can get to where the end was. Goodness sakes, so I haven't had this used more than I thought. And you'll be tearing off clumps like this to use to wash a wound. So you can tear off clumps of a cotton roll to wash a wound, or you can use several of these. Either way works really well, but it's when we're washing a wound, because horse wounds are dirty. They're out in they're dirt, and there's manure, and there's all kinds of contaminants. We're going to wash that wound, have a big bucket of antiseptic water that's got some solution in here like this, and we're going to be using this, clean the wound a little bit, throw it away, grab a new one. Clean a little bit, throw it away, grab a new one. So that this, we're not recontaminating the situation by using the same thing over and over again. Sometimes we have medicated shampoos. That's another way. This is actually if your horse is having a skin condition like skin rot or rain rot or something like that, and you want to do some kind of medicated shampooing, this is a good option also. This one's called Fung Away. We live here in Northern California with a lot of oak trees, and our horses a lot of times get what's called oak fungus. And oak fungus affects the skin on their face, where they'll kind of get these little blotchy patches where the hair will fall out. And so some kind of a antifungal spray can be really helpful for oak fungus or also for rain rot to try to calm the skin down so that it can heal. Let's see what else here. We have syringe. This is sterile syringe and sterile needles. These you have to get from your veterinarian, and they will give them to you when they know that you are qualified to be giving your horses shots. Most horse owners are very comfortable giving an IM shot, which is an intermuscular shot. In the haunches, I highly recommend that you give these all IM shots in the haunches, either high on the hip or low on the hip, down around the buttocks, just because there's more muscle there and the medicine you're injecting can be absorbed better, and they won't get those stiff, sore, hot necks that they get to give them shots in their necks. But anyway, to get syringes and needles, that's something you'd have to talk to your veterinarian about, because you can't go and buy these in the store anymore. This is Banamine, and so that's why this is injectable Banamine. So it comes in a vial, and that's why I have the syringes and needles, so that if I need to use this, I can inject my horses with Banamine. Most of the time, people are pretty comfortable with a Banamine paste. Pretty easy to use. It gives the weight on the side here. It says that from this point to this point is 1,000 pounds worth of dose. And so I can adjust this according to the weight of my horse and give this paste orally. Horses do not like the taste of this. They think it's pretty terrible. So if you can, make sure that when you put that in their mouth to give them that dosage, that they don't have any other food in their mouth, because if they have a little wad of hay in their mouth or something, they will wrap it up in that banamine paste and spit it out, and you'll have to start over again. And the point of using banamine paste is to help the horse, so you want to make sure that they get that in their mouth and it stays in there. Let's see, and then a good pair of scissors. I can't guarantee this is a great pair of scissors, but it's good enough for what I need it to do down in the barn. Whether I want to cut some of this, I need to cut a roll of gauze. Maybe I've got some gauze here that I'm going to put around a wound, and I can't tear this, so I'm going to have to cut it so that I can have whatever I need. So you always have to have a pair of scissors around. And another thing that we have in the barn readily is vet wrap. So this is a type of elastic bandage that sticks to itself, so I don't need to tape it on. I can roll it back up and squeeze it if this was on my horse's leg, and it's going to stay there. These are one-time use only, so once I've applied that and take it off, then I'm throwing it away afterwards. But these are really handy, especially if we're doing a lot of wrapping for a wound that needs to be constantly covered with something. Then we use vet wrap so that we can get the right tension on it. It holds really well if the horse is still active or out and rolling and so forth without coming off, and then we just throw it away when we're done. There's a whole lot more that we all have in our barns for taking care of our animals. We talked about different types of leg wraps, whether we're using clays or poultices or sweats. There's other types of topical applications that we can put on horses to help them, different shampoos that help them with their skin and their hair condition and so forth. But just get a basic arsenal of things to help you with some basic home health care for your horses, and you can manage to get through most of those. I'm Erin McChesney. This has been True Partnership, the McChesney Method. And remember to keep your horses, and remember to meet your horses where they are, and to have a great day and always enjoy them. So you're pretty special. Huh, buddy? Please send your questions, comments, and suggestions for further episodes to Twitter at True Partnership, the McChesney Method, or via email, truepartnershipmcchesney@gmail.com. And remember to always meet your horses where they are.